So at this time, I would like to pass it over to NAHEWD's PI, Dr. Daria Bacher-Lattimore.
Thank you, Liz. Well, good afternoon and good morning to everybody. As Liz said, my name is Daria Bacher-Lattimore. So I'm the president of the National Alliance for HIV Education and Workforce Development, or NAHEWD. And I'm also the principal investigator on this project. And I'm pleased to serve as the moderator for today's session. And Liz, who you just heard, is our project manager for this project, and she'll be managing the chat for us. So this is the second webinar in our series, Bridging HIV, HCV, and Substance Use Disorder, Innovations in the Field. And this series is hosted by NAHEWD in partnership with the AIDS Education and Training Center program and the Opioid Response Network. So NAHEWD is a membership organization of the 8 regional and 2 national ATC programs, established in 2010 to support the development of the HIV healthcare workforce. NAHEWD collaborates with multiple organizations in this mission and to support the work of the ATC program. Since 2018, NAHEWD has been part of the Opioid Response Network, or ORN, and ORN is funded by SAMHSA via a grant to the American Academy of Addiction Psychiatry. ORN was created to support efforts in addressing prevention, treatment, and recovery of opioid use disorder. ORN provides free resources and technical assistance locally in communities across the United States and all its territories. NAHEWD is proud to be a partner organization of the ORN to address the intersection of HIV and opioid use disorder. So please visit the ORN website for more information, where you can also submit requests for technical assistance. So today's program is accredited, and we will be providing continuing educations for those that you can see listed on your screen. So please make sure that you complete the evaluation that is emailed to you after the session in order to obtain the appropriate credit or your certificate of attendance. We'll also have that link in the chat at the end of the session for you. So again, after you complete those evaluations, your certificate will be also emailed to you. Okay, so let's move on to our program. So I'm very pleased to introduce to you Elena Merriweather, who is the Director of Behavioral Health at the Medical Advocacy and Outreach's Copeland Care Clinic in Alabama. Let me stop sharing my screen and let Elena go ahead. Thank you.
All right, well, first and foremost, thank you so much to the representatives from the National Alliance for HIV Education and Workforce Development for inviting me to be a part of this experience and share information with you about our program that we have implemented regarding our Take Back, Educate, Inundate initiatives here at MAO. We really, really appreciate this opportunity to be able to share our experiences with you today for this training. So as she mentioned earlier, I want to encourage everyone to please utilize the chat feature to share information with each other. I don't know that I will necessarily have access to the chat information, but although I'm sharing information with you about our particular program, if you have initiatives and programs that are similar or that are innovative that you've been able to implement in your respective workplace, please feel free to share that information in the chat feature as well, so that we can mutually and collectively learn from one another. So we're going to go ahead and move forward with our presentation for today. So hopefully everyone can see the slides, and I want to just very briefly review the objectives of what we're hoping to accomplish over the next hour. We'll talk a little bit about the impact of the opioid crisis in Alabama, talk a little bit about innovative approaches to preventing opioid use disorders in Ryan White care settings and clinics, as well as aid service organizations. And we'll talk a little bit about the benefits of implementing a multi-layered program intervention and strategies in an effort to reduce opioid misuse amongst patients or clients, as well as service providers. So before we move forward, I'm going to talk more so about what is taking place here in Alabama first. And I will say that this information is continuing to update on a regular basis, but as of the time that this information was submitted, this is what the data actually, the data that was actually available. But because we have people participating from different parts of the country, what I want you to do is just kind of think through how the opioid crisis has impacted your respective community as it relates to your state, as it relates to the different jurisdictions within the state. Think about it from that perspective as I talk about what has taken place here in Alabama. And as we move through the discussion, I'll also share a little bit more with you regarding just some recent data that was published in the last couple of days or so. But the information that we're about to share is data that was available that assisted us with developing our approach to addressing opioid prevention within our particular organization. So I just wanted to kind of set the stage with that information first and foremost. So when we look at the opioid crisis in Alabama, now this is, once again, this is data from 2015 to 2017, and all of this data is what resulted in our development of the initiative. So as you think about how you can develop initiatives for your state or your respective organization, look at your data and how that can influence or drive what you do to address this issue in your community. So we just kind of shared a little bit with you about the deaths that occurred as a result from overdose during that particular time period. And then we look at 2017, what actually attributed to those different overdose deaths within the population. And then we look at in 2018, how 11,081 drug overdoses were related to emergency, were reported through emergency department visits, okay? And what we found was that 2,180 of those, approximately 19% of those were related to opioids. So this is the data that we kind of looked at as we developed our program, and want to once again emphasize for you to just kind of do the same as you think through what can work best for your organization. So one thing we had to really take into consideration is the fact that overdose deaths are not limited to just opioids, of course. We also have to take into consideration prescription opioids as well as heroin, that also accounts for a majority of deaths as well. So in 2016, Alabama actually ranked first place in the nation for per capita prescriptions, 121 prescriptions per 100 persons. That was really significant for us. In 2019, we remained in the highest per capita for opioid prescribing. There was a decrease from 2016 to 85.8 prescriptions per 100 persons. So just kind of want to share just a little bit about that as well. So in 2017, our governor, Kay Ivey, established the Alabama Opioid Overdose and Addiction Council. And that council was actually under the development of three primary key leaders within the state of Alabama: our state health officer, the commissioner for the Alabama Department of Mental Health, as well as the state attorney general. And they led the movement to look at what is it that we can do to address this in Alabama. And one thing that they came up with was the development of a strategic plan, okay? And that strategic plan is published on the Alabama Department of Public Health, as well as the Alabama Department of Mental Health website. And it outlines the different strategies that we have engaged in within the state to address the opioid crisis. And so once again, I want to just emphasize the importance of looking at what your state doing as it relates to top leadership within the state and initiatives or advisory committees or stakeholder committees that have been pulled together to look at the different issues. And it will look different for each state, but just something to kind of think about as you research this more within your respective jurisdiction. So when we looked at the strategic plan, there were 8 subcommittees that were developed. And with the development of those subcommittees, they kind of just looked at all of the different factors that contributed to the opioid crisis in Alabama. And so what we've done is we've listed all of those different subcommittees, but there was also a strategy linked to those subcommittees that each of those participants actually worked on within the state. So one of those subcommittees included community engagement to also look at what is taking place with the veteran population. There was a subcommittee that addressed prescribing and dispensing. Another subcommittee looked at rescue, and that primarily included a lot of first responders in the community. There was a committee that looked at treatment and recovery. There was a data committee that just kind of looked at all of the data that was coming in from the different segments of the population, law enforcement, as well as prevention, education, and workforce. So each of these different subcommittees addressed just kind of explored and began to have dialogue and conversations with a diverse range of stakeholders on how to address these particular issues within the state. And so from that, there were council recommendations. And with those council recommendations, there was a significant emphasis placed on doing more as it relates to prevention. Okay, there was an emphasis placed on how do we intervene to reduce overdose rates and deaths. There was more emphasis placed on the treatment element as it relates to opioid use disorder treatment and substance use disorder treatment, but also integrating the recovery component in that aspect as well. And then a community response. How do we engage the community to take an active role in preventing opioid use disorders, okay? And then the workforce development element as well, which is a part of what we are doing right now. As a part of this particular initiative, we are hoping to increase awareness within the workforce for those of us that work directly in HIV service organizations or affiliated agencies. Okay, so we're actually supporting a lot of the recommendations by having these conversations and these dialogues. So these were the key recommendations that came from the different subcommittees, and so their work actually started within these particular areas. So I want to just pause for a minute because this will significantly influence where we go in the presentation. And I also included the link at the bottom of this particular slide because it will take you directly to the state report that I mentioned in a previous slide. Okay, and these slides will be made available to you. Okay, so start thinking from the perspective of prevention, intervention, treatment, and community response, okay? And the workforce development component and how all of these different components impact opioid prevention. So a little bit about medical advocacy and outreach, and all of this is going to kind of tie back in together. But I want to tell you a little bit about who we are. We are a Ryan White service organization. Okay, we have an estimated 21 patients. We are about to approach 35 years of existence in 2022. We're really excited about that and already started some planning. And we currently officially have 4 hub sites where we provide services. And that is Montgomery, which we call the River Region. And the River Region covers maybe about 8 to 9 counties. And then we have Dothan, which is considered our Wiregrass area. Selma, I think many people are familiar with Selma, Alabama, due to the rich history that comes behind that, as well as Atmore, which is in southwest Alabama. So we're strategically placed in 4 different locations from the central part of the state all the way down to the far southern part of the state. But we also have 11 satellite clinics. And with those satellite clinics, they're also strategically placed in rural counties within our service area to help us to better reach and connect with people that are impacted by different social disparities, such as transportation, and they're not able to always come into our hub site. So we do those satellite clinics where we do a lot of telebehavioral health services and patient services as well. So I wanted to put that out there because all of this really does impact what we are doing to address the opioid crisis. So if we move on to our next slide, in the introduction, I was introduced as the Director of Behavioral Health. So I want to tell you just a little bit about what we do in the Behavioral Health Department, because this project was birthed out of the Behavioral Health Department. So we do a lot as it relates to substance use and mental health consultations with our patients, okay? We do individual and group therapy, behavioral health screenings, as well as assessments, linkages and referrals to state certified treatment providers, as well as professional development opportunities through training and education, very similar to what we are doing right now. And that is something that is very, very important to us within our department, because we do a lot of interdepartmental training, intra-departmental training, but also within the agency and our constituents in the community as well. We do recognize that we cannot do everything and meet every single need, but through our collaborative partnerships with other community organizations, we're able to holistically address the different needs of the people that we work with. We see quite a few people who have been impacted by different behavioral concerns within the community. Within our particular agency, when we talk about behavioral health, we're specifically referring to people that have mental health issues or substance use issues. They may or may not be diagnosed, but we want to look at those issues that have the potential to impact medical care. We want to look at those issues that have the potential to impact medical compliance as it relates to our patients making their doctor's appointments, following through with taking their medications, just being compliant overall. And so our behavioral health services support that process so that we can make sure that our patients are able to function from a healthy place and become virally suppressed. So I wanted to kind of share a little bit about that, because when we look at our next slides, we want to consider why opioid prevention in our Ryan White care settings, okay? One thing that we've been able to kind of look at across the board is the fact that 40 to 45% of people who are living with HIV have been existing or previous injection drug users. And that's something that we have to look at. 40% of people living with HIV are either associated with injection drug use or directly or through unprotected sexual contact. So we want to kind of take into consideration those different factors. And then we also look at the fact that people living with HIV who self-identify a prior history of illicit drug use, okay? And then people living with HIV who are diagnosed with other comorbid health conditions where controlled substances are prescribed for pain management, okay? So those are some things that we had to look at when we developed our internal program. So once again, I want you to think about, we're narrowing this down, okay? We first started talking about thinking about what's happening in your state, but think about what's happening within your organization with the people that you serve, okay? Think about different comorbid health conditions, different behavioral issues, different social determinants that are impacting the people that you serve. We focus a lot on the HIV care and the education, but we also want to look at those other social determinants that can impact healthcare as well. And this is how we develop our programs to meet the needs of the people that we serve. So taking all of that into consideration, and as you think more about what goes on within your state and the constituents of the organization that you work for, this is how we came up with our initiative. We focus on take back, educate, and inundate, because we had to look at a process that would work for us. So this is very much customized to MAO, but it can be replicated. Okay, so that's why we're excited about talking about this. It can be replicated. So this is what we mean when we say we have a multi-layered approach to opioid prevention, a multi-layered approach. And so we're going to talk about each one of these layers, starting with take back. I think everyone is familiar with or is aware of the National Take Back, National Take Back Observance that occurs annually in April and October of each year. Now, there have been some adjustments, of course, due to the COVID pandemic in the last year, as well as continuing on through this year. So with our Take Back, Educate, Inundate initiative, we established partnerships and looked at how we can reduce the opioid crisis within our organization, with the patients that we serve, with our family members of patients, with our staff members, just within the organization. What is it that we can do simplistically? And so in April and October each year, we make a huge push towards encouraging patients to bring in their expired or unused medications, not just theirs, but also encouraging them to bring in their family members' medications as well. So I want to kind of pause for a moment, because this is an initiative that started, I want to say, in 2019. And so in 2019, we primarily just focused on April and October because it was startup and we were trying to figure out what we were doing and how this was going to work. But since that time, it has become an ongoing initiative, and you'll understand more about that as we move into future slides. So I want to talk briefly about the education component of the initiative, and it's pretty simplistic. It's exactly what it is. We have fact sheets, we have just pamphlets and brochures, so that whenever we have an encounter with a patient that comes in for services, we utilize that as an opportunity to say, hey, how are you disposing of your prescription medications? What are you doing with your expired medications? We use that as an opportunity to just educate them on what they can do personally to reduce opioid overdose, but also medications getting into the wrong hands. So anytime we have that opportunity to interact with that patient and share that information, we do that. Now, within behavioral health, what we do when a patient has their initial intake into the behavioral health department, that is our opportunity. We talk about it at intake, but we also continue to have conversations with them about it as they come in for services. We also work with other departments within the agency to share the same information and get our education materials and health literacy information out to patients when they interact with them as well. So between the entire agency and multiple departments that are interacting with patients when they come in for services, we're able to educate them and engage them in our commitment to reduce overdose rates and the opioid crisis within the state. So the way that we do it one patient at a time. We do it one client at a time. We do it one staff member at a time, with hopes that they will take that information and share it with their network of people as well. Another method that we use is just through basic training and continuing education with our agency staff and community healthcare providers. We do a lot of trainings in the community, and we utilize that as that chance to put out information about our initiative, okay? And so any training, any program that we have, we're probably going to integrate a topic dealing with Take Back, Educate, Inundate, and how it's actually implemented. We might, since of course everything has been virtual over the last year, anytime there's a break in between a training, we might put up an infomercial that talks about Take Back, Educate, Inundate. So when there's a break or a pause, or even if there are technical difficulties and we just need to put something on the screen, there's a message that's going around about Take Back, Educate, Inundate. So anyone who's engaged with us for any purpose, they are continuing to hear about this initiative with the hopes that they'll just think about what they can do personally as well as professionally. So the third layer of this initiative is the Inundate component, and it's very self-explanatory. And what that pretty much means is that we inundate the community through mass distribution of health literacy materials pertaining to substance abuse prevention, using multiple social media sites. We do have an internal staff member that manages our social media, and he inundates all of our followers with information about overdose prevention, okay? And so that is a very, very simplistic and easy way to get information out in the community, and it has worked very, very well for us, and we'll continue to share how we're doing more of that as well. So in order for this to work, especially for the take back component, you want to have an active relationship with your local law enforcement. It's just all about partnering with the sheriff or the city police, whoever that law enforcement entity is within your community. They need to be actively engaged. So just have a couple of pictures we're going to show over the next few slides to emphasize how this has actually worked for us. So remember, we started this in 2019. We're just kind of trying to figure it out, knew a little bit about what we were doing. And so you'll notice we made our own box. We made our own take back box, and you'll see it's just a it's just a cardboard box, and we put very durable plastic inside the box. And you'll see that we have an officer here from our Montgomery County Sheriff's Department, as well as a nurse practitioner. And so this nurse practitioner brought in medications and disposed of them with law enforcement at our, I think this might have been our April take back observance in 2019. So this is just a visual of how that actually works. And you'll see that this location is actually in the lobby area, and it was easily accessible to our staff and to our patients. Now, one thing that I do want to emphasize, which is not visible, it is also accessible to the public. But what you cannot see is that we do have a surveillance camera on the other side of the room. Okay, so we did have a lot of questions earlier on with planning about safety and security and people possibly tampering, but we managed that very, very well. So just wanted to kind of give you that visual. We also wanted to make sure that we were documenting the prescriptions that we were receiving. And you can kind of see the signing the documentation sheet. It was a customized, self-created documentation form. And on this form, primarily what we did was we just listed the type of medications that were actually brought in and what the dosage amount was. Because after the fact, when this particular take back had concluded, it allowed us to be able to kind of go back and look at and see what type of medications people actually brought in and that we were able to take back. So that was just something that we wanted to do to really see, okay, what are we collecting here? Okay. So this is just another picture that reflects the collaboration is a staff member, and what she's actually doing is making sure and verifying that the name on the prescription bottle has been removed before it is actually turned over to law enforcement, because we want to make sure we maintain HIPAA and protect the confidentiality of the person who is donating the medications. One thing that we have had to do continuously is just remind people to remove their names from the medication bottles. Some do, some don't, but we take that extra step to just make sure that we have removed them before we officially turn over the medications. You'll also see that we just kind of created a sign, put it on the top of on the side of the box, taped it. It worked out really well. You don't have to spend a whole lot of money. It's something that you can create yourself, and it does work. So this was in our first year. So, you know, we felt pretty good about what we did, and we were able to secure some additional resources and funding, which allowed us to purchase secure medication disposal bins. And so this is just a sample of one that worked really, really well for us. And this particular bins, which you cannot see the surroundings of it, but it is located in the lobby of our pharmacy area. So when our patients are coming in and out of the pharmacy to pick up medication, to pick up their prescriptions, if they have medications that they need to dispose of, they can dispose of it directly in this particular disposal bins. And so we purchased several of these bins and strategically placed them in different places throughout the agency where patients have access, but also where staff have access. So this is how we are actually implementing this within the agency. So moving forward, we're still collecting, and we look at very creative ways to actually collect. And this was actually a training that we did in 2019, where we did integrate this particular topic as a part of the training, but we also had exhibitors around the room. So a part of our display exhibit, which you can see in the background, is our medication disposal bins, which is placed on the table. So as a part of our marketing process for the conference, we did make sure that participants, well, registrants knew that if they wanted to dispose of their medications, they can bring it to the training and put it in the disposal bins. And so this was a picture that we were actually able to capture before this law enforcement officer emptied the bins. And you'll see, you can kind of barely see it, but if you notice on the floor behind them, there's a box on the floor, and that box actually was brought up from our Dothan location from medications that were collected. So we just captured a photo with him before he took all of our drugs away. Okay, so moving forward, benefits of how this program actually helped our agency. It was very easy to integrate it into our programs, into our existing services. It increased our collaborative partnerships with non-Ryan White service providers. It also allowed us to begin looking at how this can be replicated with different human service agencies in different settings, but it also strengthened our coordinated efforts with law enforcement officials. We want them to know us for the right reason, and we want them to be able to, you know, be a part of our experiences and work closer together. But it was also convenience. There was a lot of convenience with on-site medication disposal for the agency as well as the clients that we serve. And then just professional development overall, okay, which is, again, what we are doing now. So how did we support the council recommendations? This is what we talked a little bit about in the earlier slides. So what we are doing is we are preventing prescription medications from entering the wrong hands through our take back efforts, okay? If we just work with our staff, we work with our patients and family members, that is a collective group of people that we can engage in preventing these medications from getting out on the streets. We're intervening by providing education and conducting screenings with our existing patients, okay? We do that utilizing the SBIRT evidence-based screening tool, okay? So we're intervening with patients who are receiving behavioral health services by screening them for drug use, okay? We're facilitating treatment opportunities by coordinating linkages and referrals to certified state treatment programs, okay? We're supporting community response efforts by launching Take Back, Educate, Inundate initiatives with our Ryan White clinic staff, patients, clients, and family members of the agency. So that is how we're implementing this, but also workforce. When we have new employees coming on board, we make sure to orient them to our Take Back efforts. We utilize our internal media relations specialists to inundate the community with these different messages. And one thing that we really focus a lot on are the different National Health Observance Months and National Health Observance Days. We put a lot of emphasis on that. But like I mentioned earlier, we also share information during the new patient intake process, and we pride ourselves within the agency as well as the community on just information sharing overall, disseminating the information in the community so people who need it, they can get it. So in 2020, we thought we were going to expand our project, okay? So initially, our project was supported by the AmerisourceBergen Foundation with a grant that was awarded in 2019 for our Take Back project. And then, so we felt good about what we did, and we partnered with a couple of agencies. And so in 2020, we thought we were going to expand, okay? And so we listed a couple of those agencies here, and I want to just talk about them very briefly because it is so important. The Dannon Project within the state of Alabama primarily serves returning offenders, people who have been involved with the justice system for drug-related crimes or other crimes that involve possession of drugs. So we target organizations that do not do what we do, but have access to the population that we're trying to reach. Okay, we partner with AIM, Aid to Inmate Mothers. They work directly with women who are being released from prison due to a multitude of different crimes, but also due to use as well as abuse as well. And then we partnered also with an organization called COSA, Council on Substance Abuse, to also help with the dissemination of prevention messages. They do a lot as it relates to substance abuse prevention. So our expansion included providing and supplying these different organizations with those medication disposal bins so that they can collect medications and take back medications with the people that they serve. So we still have the partnership, but we weren't able to expand in 2020 with this initiative. So we'll talk a little bit more about that as we kind of start to wrap up. So guess what happened? I don't think I need to tell you what happened. Everybody knows what happened in the, I'll say, February, March timeframe of 2020. And so all of this pretty much impacted what we were able to do and what we plan to do as it relates to expansion. So I don't think I need to go into too much detail about that because I know every state that is represented here was impacted in some capacity. But what I do want to focus a little bit on is the impact of twindemics on recipients with substance use disorders and Ryan White care settings, okay? And so when we say twindemic in 2020, that started the twindemic of the opioid epidemic, as well as the COVID-19 pandemic. And so we coined this term within our agency as a twindemic, okay? And so I didn't make this up. I actually got it from my executive director, but I thought it was really, really neat and wanted to just put this out there. So how did it impact the people that we serve? HIV and behavioral health issues. People had a multitude of different things combined. They were living with HIV and the issues that they were faced with and dealing with, but also dealing with mental health issues and substance misuse issues as well. All of this is going on during the twindemics, okay? We saw people that had intensified mental health issues to include anxiety, depression, and adjustment disorders. There was an increase in substance use, including marijuana, methamphetamines, cocaine, and alcohol use, as well as an increase in other addictive behaviors, including overeating and shopping and video games and smartphones. And think about what's going on in your state. Think about addictive behaviors that you learn about with the people that you work with. Okay, so I wanted to just kind of share that is what we had to deal with. So we weren't able to expand with our partners. We had to come back to the table and regroup and figure out, okay, what are we going to do? So we got creative. We got very, very creative. And I have to just emphasize the importance of working with your community partners and people within your organization that can come up with creative methods of doing things that you can't, okay? Because I could have never come up with this one. So our media relations specialist came up with the idea of selfies, okay? And so what he usually does when we have a National Health Observance Day, he will create a selfie image. And if you can see this on my left, potentially you're right. And this one was actually created I think August of last year during International Overdose Awareness Month, okay? And he just put a couple of images on here from our partnering agencies and also put at the top why it matters to me. And we challenged all of our staff members and our partners to write their personal message around why we need to end the opioid epidemic. And everyone wrote their message and they held their message in front of them and they took a selfie, okay? And then we posted those selfie messages on our our social media sites. In addition to that, he created very, very unique banners and just images with a diverse population of people with messages around in the opioid epidemic. Now, it might not be as clear, but if you see the image where you have the three bubbles and then you have the open hands that are holding the bubbles, well, in each of those images, we have our message. One image has take back, another bubble has educate, and another bubble has inundate. And the hands are there to let you know that this is something that we believe in, this is something that we do, this is something that we hold very close to us, okay? And so that image has been put on pretty much all of our materials to promote this within the community. So these banners can actually be included at the bottom of a signature block, in an email. You can just a bunch of different things that can be done. So we weren't able to get out and pass out information. So we looked at how we can put information out there through social media. And whenever we would potentially email someone, if we had this banner at the bottom of our email, anyone that received an email from us would actually see this image. More creativity during the twindemics. This is just an example of how we utilize our cell phones to promote messages in the community, how postings were done. They're not very clear because they're so small, but if you look at the cell phone on the left, you can kind of see probably about 4 people that did a message, and we were actually able to post that message. So that's just an example of that. Okay, and then you'll also see pictures of what we posted on Facebook as well as Instagram. And I want to emphasize the diversity of them. We tried to create them in such a way that will reach pretty much anyone in the community. And so the one that was, I have to say, that was my favorite were the 2 I don't want to minimize who they are. I'm going to say the 2 kids, because kids are always on their cell phone. They're back to back to each other. And that message was that visual helped us significantly in reaching the adolescent teenage population, because they're always on their cell phones. Okay. And we put the message that we wanted to convey on that particular slide. And so I'm sorry, not slide, but image. So just kind of take a look at those, and anything that we can do to kind of share more information. But this is intended just to give you some ideas of some things that you can do as well. So as I begin to wrap up, this information that I'm about to share is not a part of the PowerPoint, because it was just released a couple of days ago, and I really wanted to share it. And it's information that was published by CNN on an article that they published a couple of days ago with data from the CDC as well as the National Center for Health Statistics. And they titled it, "During the Pandemic, Another Devastating Health Crisis Was Growing." Okay, and I want to just read that for a minute as we wrap up, because this will highlight the importance of the last 2 to 3 slides. So it states that drug overdose deaths rose by close to 30% in the United States in 2020, hitting the highest number ever recorded. The U.S. Centers for Disease Control and Prevention reported Wednesday. Okay, more than 93,000 people died from drug overdoses in 2020, according to provisional data released by the CDC's National Center for Health Statistics. That's a 29.4% increase from the 72,151 deaths projected for 2019. Overdose deaths from synthetic opioids, primarily fentanyl, and psychostimulants such as methamphetamines also increased in 2020 compared to 2019. Cocaine deaths also increased in 2020, as did deaths from natural and semi-synthetic opioids, such as prescription pain medication. So I mentioned earlier that the data that we shared in the first couple of slides was based on data prior to 2019. Okay, so it is a little dated, but that was the data that we used to develop and create our project. I think it was very, very important that I shared this data with you today. I just got access to it a couple of days ago, but it just kind of gives you an idea as to what is taking place nationally within our country as of right now, real-time data. Okay, so wanted to share that because, once again, look at what's taking place in your state. Look at the initiatives that have been emphasized within your state and what type of programs you can develop and launch within your organization. So as we wrap up, this is something that we can all do. We can join the campaign. We can join the campaign, and we can join the campaign because this presentation is very timely. I purposely and intentionally selected it to occur during the month of August, which is International Overdose Awareness Month. August 31st is considered the actual day for this particular observance. And it says a time to remember, time to act, okay? And so with this, I pretty much just, of course, copied it and pasted it directly from the site. So I want to make sure you know, where this information came from, but more so encourage you to get your own information and research this information for yourself, because there's a lot out there, and you have just enough time over the next couple of weeks to figure out, okay, what can we do in our organization to raise awareness around the importance of International Overdose Awareness Day, okay, which is the largest annual campaign to end overdose. Remember, without stigma, those who have died, and acknowledge the grief of the family and friends left behind, okay? It is a time to remember. It is a time to act. I think most of us, if not all of us, have been impacted in some way by the opioid crisis, either by knowing someone who has overdosed or someone who has come very close to an overdose, or maybe just knowing someone who knows someone. So we want to just pause and think about those individuals who have been directly impacted, but also people who have been indirectly impacted as well, okay? And in memory or in observance of that, what can you do? How can you act out, okay? How can you act out? I think that is very important to emphasize. So with that, that concludes my presentation. I hope that everyone was able to glean something from the data that was shared, as well as the initiative that we have launched within our organization. If it's something that you can utilize or replicate, you know, feel free to reach out to us. We're happy to share information with you to help you in your efforts as well. So I want to encourage everyone, especially those of you that are participating on this platform today, to join the campaign. Join the campaign personally, join the campaign professionally, and let's work together and collectively to reduce overdose rates within our country. Thank you.
Thank you very much. That was a fabulous presentation. It was very impressive, from bringing together all your different stakeholders that you did, as well as the role of communication and your community linkages. So thank you for sharing all of that information. We do have one question in the chat, and it's from David, and he's asking, how are the drugs actually disposed?
Okay, so what I have been informed by law enforcement is that what we do is we pack them up. Well, let me back up. I want to really emphasize this. We make sure the labels and there's no identifying information on them. And usually we, within the agency, we might dispose of them in a very large garbage bag, or one of those red hazard bags, and we just tie it up. So that is how we dispose of it to law enforcement, okay? Law enforcement, our county sheriff, they work closely with the DEA agent within the state, okay? And I think there are DEA agents in different regions of the state. And so what they do is they take the medications, the law enforcement officer takes the medications back to their office and they weigh them first. Okay, let me emphasize that. I didn't mention that and I apologize. They weigh them first, okay? And once they weigh them, they'll give us a call back and say, hey, for the month of June, you gave back 15 pounds of medications, or you gave back 40 pounds of medications. Okay, I wanted to emphasize that because we want to know how many pounds did we contribute to the overall number of pounds, because I think with the National Take Back Observance Days, you'll hear on the news where well, we collected 44,000 pounds of medications, but that's not one person. Those are multiple organizations that have turned their medications over to the DEA. Okay, so I wanted to emphasize how that process works. So once the law enforcement officer takes it back to the sheriff's department or wherever they take it, they weigh the medications, call us back, give us a number of pounds, and then they give them to the DEA agent. And I will say this, I only can assume that they dispose of them at some undisclosed, unidentified location that no one knows about but them. And I have to be honest and say, I've never asked because I'm just happy to get them off of our hands and out of my office. So I've never asked where they dispose. I just know that it is turned over to the local DEA and they take it somewhere and they dispose of it. So it might be different in different states. It might be different in different states. So one way to find out about it is contact your local law enforcement, ask who does prescription drug take back, okay? And then once you connect with that person, you can kind of get an idea as to how and where the medications are disposed of. I have to be honest, I really don't want to know. So I'm just glad to get it off of my hands.
Well, thank you very much. I do have a question. I mean, your program is obviously communication is very key, both internal to your organization, but also external with the community providers and also the different community linkages that you've established. I'm just wondering if you have any best practices or advice on how do you maintain those relationships with these other community providers?
Well, one thing that we do is, you know, we support each other. We support each other when we don't need anything. It's all about just having good relationships and not just calling on people when you need something. Sometimes it's really just about, hey, hadn't talked to you in a while, hadn't heard from you in a while. How are things going? Is there anything we need to do to support what you're doing? We keep the conversations going even when we can't actually physically come together and connect and work together. And so we've had to be really creative with that in the last year. And so we just make sure we maintain that open line of communication and we're sending them information and we don't just call on people when we need them. Sometimes we just shoot an email to say, hey, how's life? How are things going? You know, to let them know that we are concerned, we do care and we want to support whatever it is that they have going on and vice versa.
Well, thank you very much for your time and your presentation today. I just want to remind folks that Liz has posted a couple of resources in the chat room for you. And also, if you are requesting continuing education credits, you need to complete that evaluation within 2 weeks of today's session. And we will have another webinar in September on the 10th at 12 p.m. Eastern. And you can see more about that on the NAHEWD.org website. And yes, Elena, did you have one thing to add?
Yes, I'm so sorry. I forgot one of the most important things. I didn't make this stuff up. These are my references. Okay. I want to highlight the references because everything came from somewhere with the exception of what we're physically doing here within the agency. So I wanted to make sure I emphasize those references and just my contact information on the last slide. That's it. I'm sorry.
Fabulous. Thank you so much. And again, the PDF of the slides will be also on the NAHEWD.org website for your information. So thank you all for joining. And Liz, did you have any closing remarks? No? Okay. Thank you all for joining us on a Friday in August and for a fabulous presentation, Elena. Take care.
Thank you. Thank you. Thank you for joining us. I appreciate it.